Good morning, everyone. I hope y'all are having a great Sunday. This is Out of the Binary, a trans healthcare workshop. My name is Sin. I use they, he, she pronouns, and I am with Feminist Center for Reproductive Liberation. So, yeah, just to tell you a little bit about what we're going to talk about today. Um, Feminist Center, it's an organization here in Georgia, and we do stuff like advocacy training. We have like lobbyists at the Capitol, um, checking on reproductive justice bills. We also do have Lift the Latina Voices initiative, where we do a lot of workshops training people so that they may go into their own communities and share the knowledge. We also have a trans health initiative where we connect people with the resources that they need. And we do have a physical clinic where we offer abortion, hormone replacement therapy, and GYN services as well. Um, we are located in Atlanta, Georgia, if anyone happens to be a local. I know we're from all over the states today. And yeah, again, my name is Sin. I am an immigrant. I am from Mexico, and I've been in this country for about almost 10 years now. Yeah. I came across feminists due to a friend that was working with them, and they told me about the job. And once I read their mission and their vision and the work that they're doing in the state, I was very eager to join them. And I've been working as their grassroots organizer for the past almost 3 years. Um, so yeah, I take charge in voter engagement, civic engagement, and I get to host a lot of educational workshops like this one. So, yeah, all right. So, just to tell you all a little bit about what we're going to talk about today, we are going to talk a little bit about the legislative landscape for trans healthcare in this country. We are going to talk about gender affirming care when it is not about hormones. And then we will touch a little bit about what hormone replacement therapy can do for you. All right, so first, before we start, um, just want to touch on that the workshop is grounded in understanding that gender affirming care is not only healthcare, but it is a human right. And we are going to take a moment, we're going to hold space for the grief, anger, and resilience that we have in this room. I'm very happy that everyone is here in this room. I'm happy that everyone's participating in this conference that Plume is hosting. Um, because no matter what's happening in the world, like we're still here, we're with each other, and we give each other power. So we're just gonna take a few inhales and exhales before we start. So for those of you who it's your first time maybe hearing what a legislative session is, because I sure didn't know like a few years ago, I was not aware of what it was. So the legislative session is the time in your state when the lawmakers, when your legislators, when your representatives, they meet and discuss on how to vote on new laws, on budgets, on public policies, on what they do with their money. They're the ones that decide whether the bathroom bill passes or not, whether an abortion bill passes or not. This is what happens during legislative session, and in each state it's different. How long it lasts, at what time during the year it happens. So yeah. Now, I want to talk a little bit about the trends of anti-trans legislation during this year. I got this information from translegislation.com. If you go onto their website, they have so much more information. They have detailed on the bills for each state. And I want y'all to take a look at like the increase of bills over the past 4 years. Um, I hadn't looked at this graphic until like a few weeks ago, and it really did take me aback because I really it's it's really hard to understand how over the past few years we went from 150 bills being considered to 1,000 bills being considered against us. Um, so it's really depressing. It's really upsetting, and I hate that. I hate this country. I really hate this country. Um, and I'm really sad that this is happening because, well, a lot of bills do pass. A lot of bills do pass. So I'm gonna take y'all to a little interactive thing. So we're gonna do a Mentimeter. So I want you to think over the course of this year, or maybe not just this year, but like last year too. I want you to tell me um which bills can you think of that you heard that were trying to be passed. And give me 1 second, I'm gonna put the Mentimeter in here. Yeah, I think y'all can see my screen. Can y'all see the Mentimeter? I think the chat is so okay, perfect. Mm, So if you go on your computer or on your phone and you just go to mentimeter.com and it's gonna ask you for a code, it's gonna be this one right here at the top. So you can put the code, and then once you put in your answer, they will all start popping up here very cutesy. And I'll give y'all a second for the answers to start popping in. And feel free to put more than one. Too many to count. Gender markers. Can you expand screen? Oh, thank y'all for sharing the code. Mhm. Okay, we have 18 participants. I'm gonna give just one more minute to see if anyone else wants to participate. All right. So yeah, we can move on with just this few. Um, it is sadly too many legislations that I can think of to count. Um, it's kind of one of the reasons why I'm not putting a list, because it would be never ending. I tried writing some down, my hands started hurting from how many legislations there is. We know there's been bills against drag in public, against using the bathroom, the alliance with your gender, against flying the LGBTQ pride flag. Um, I know in Georgia they passed a bill where you can, if you're an incarcerated folk, um, you can no longer get your hormone replacement therapy. Um, Kids from K to 12, they're no longer able to play sports. Trans kids, that is. Um, there is too many use of public restrooms. Okay, so we're gonna go back. All right, we'll go back here. And yeah, like just want to take a second. Like, I know this is very sad. This is very upsetting, and there's so many antitrust legislations popping up all across the country, and legislating session is coming in again in Georgia. It's starting this month. I think on the 12th. So, what do we do? Where do we go from here? I know for me, I was feeling very hopeless. I'm like, what even do I do? They're taking away abortion rights. They're taking away gender-affirming care for kids. They're taking away everything that they can. So, where do we go from here? I'm here not just to tell you like, hey, this anti-trans legislation, this sucks, because we all know that it's happening. We all have heard of it. I see that you know like way too many legislations, and you're like, there's so many. So where do we go from here? So like I said, I am a civic engagement for feminists. So what I want to do is encourage you all to reach in to look in your state for organizations that have lobbyists that do civic engagement so that you're able to feel like you like I want you to know that there's organizations that are fighting this, that it's not just happening and everyone's just letting it happen. I want you to know that there is people fighting for it. Now, what can we do as a community? We start by uplifting mutual aid, like okay, maybe Medicare stopped letting you use Medicare to pay for your hormone replacement therapy, but we can share mutual aid. We can help everyone get their needs met so that you can continue to get your HRT. Um, Now, you can join, like I said, local reproductive justice organizations, human rights organizations, disability justice organizations, and support youth-led organizing, like attending their workshops. If you're on social media, like sharing their workshops. Um, and there's also other things that we can do. Let's say once you have gotten involved with an organization like Feminist. Now, I'm very big on not asking you to do something that I know I wouldn't be able to do, right? So some things that I'm able to do that I host workshops to do is calling your legislators. Most of the time they're not gonna pick up, but you can leave voicemails. You can leave thousands of voicemails. Sometimes their assistant will pick up, and I want y'all to know your legislators and the representatives that they are at the Capitol, they work for you. They work for you. So they have to listen to you. So if you call them and they actually pick up, they have to stay on the phone as long as you finish telling them what it is that you need to tell them. You can always write them emails. There's a lot of organizations that give you prompts on emails with already like talking points. Let's say I'm trying to email my legislator to get them to vote no and oppose the bill for the bathroom bill, right? They'll give you a prompt for your email with the talking points. All you have to do is like add your own touch, personalize it, and then you send it and it goes to your legislator. And there's another thing that you can do, which is go to hearings. So on legislative session, once someone introduces a bill, and it gets passed, and everyone starts like voting like yes or no, yes or no. There's something that's called a hearing, which is when the public gets to go inside the Capitol with the legislators, and you can, ay, ¿cómo se dice? Testify. You basically go into the Capitol and you testify. So me, I would show up and talk about why the bathroom bill should not be passed, right? Now, why am I telling you um, that I wouldn't ask you to do what I don't do? I don't go to the Capitol. Um, it feels really dehumanizing for me to try to go and speak to the legislators about why they should vote no on on a bill that infringes on my rights as an LGBTQ person. But I do have a lot of friends, a lot of other coworkers that are also trans that are able to show up to the Capitol. So if you have it in you and you're like, I don't care about these legislators, I don't care, I'm gonna go make my voice heard, please do. All you have to do is look for an organization. Um, Sometimes organizations host like the day off. They're like, hey, we're rounding out people to go testify to this hearing. So you show up and they give you a sheet with the talking points. They run you through what you have to do, which is basically just sit there until they call your name. You go and you give it to your representatives. You tell them everything that's on your mind. Um, and you don't even need to reach out to an organization. If you see a bill, um, let's say if you search up bathroom bill Georgia, it's going to give you the information for when there's going to be a hearing. So if you don't want to reach out to an organization, you're like, I can do this by myself. You just look up for the day that they're hosting a hearing. You show up and you can tell them what's on your mind. Now, I also have vote and mobilize others. So I know voting is at least like and within my friends for the LGBTQ community, they're like, oh, I don't vote or I do vote. It's either very strongly like I do or I don't. And I understand why. I understand that the system is broken. I understand the hopelessness. But I want you to also know that we do have a say for the people that sit in those chairs, the people that are going to vote yes or no on the bill that is going to change how we do our things day to day. You get to choose your legislators, you get to choose your representatives. So if when you think vote, you only think of like, oh, the president or the governor. No, we get to vote for the small seats too. Because while the president does do the executive orders that he just like writes and they're done with, the legislators are the ones that do most of the bills, like the bathroom bill, the gender marker, the Medicaid being able to pay for your hormone replacement therapy, for the flag flying on schools, for public drag. Your legislators and representatives are the ones that are voting yes or no. So just encouraging you all to either track how your legislators are voting, which you can find it just online if you go on Georgia and you put find my legislator, you put your zip code, it'll tell you who your representatives are. So I'm lucky that my representative, Representative Kim, she's LGBTQ. So I call her and email her to thank her. Because it's also important to thank your legislators if they're voting no for a bill that like shouldn't pass. Um, but I know for a lot of the cases, it's asking them to vote no on a bill that would harm us. So yeah. Okay, so I know that was a lot. I know we talked about sad things. So I want y'all to just take a moment before we transition into the next section. Kitty break. All right. So now we're going to be talking about gender affirming care when it's not about hormones. I find it's very important for us to take charge of, especially when there's so much hopelessness sometimes when you take when your hormone replacement therapy it's taken from you. There's so many ways that as a community we can still take care of each other, as a person that you can still take care of yourself. even when you feel like they're taking everything, there's still so much stuff that we don't need the government. Like they can't tell us, they can't take away our identity, right? So I'm going to take y'all, oh, this is not the interactive part. So gender affirming care, I'm sure most of y'all know what gender affirming care is, but yeah, what it looks like is individualized for each person. There's not one size fits all. Uh, it doesn't always include hormones. It can be social changes, it can be surgical care, and it looks different for everyone. So what this looks like, what this means, it's like preventative care, treatments, social transitions, mental health support services. It can be freezing your eggs, freezing your sperm, and these are we're going to be touching on things that just take care of our overall well-being. And yeah, now I'm going to take y'all to another interactive part. We're gonna go here, and I want y'all to tell me, what does gender affirming care look like for you when we're not talking about hormones? Maybe it is going to the gym. Maybe it is putting on makeup. Maybe it is asking your friends to call you by your chosen name. Maybe it is your pronouns changing every day. So anything that you can think of that is gender affirming care for you, I want you to go ahead and put it in here. Thank you to all of you that are participating in this Mentimeter. Not hiding anymore. I want y'all to know that there's no wrong answers to what gender affirming care looks like for you. So anything you can think of that makes you feel like yourself, put it in here. All right. So I want you all to take a look at all of these responses. If you're still typing, like, please continue to do so. But I want y'all to take a second and look at what gender affirming care can look like for everyone. I want you to take it in and realize that this is stuff that they cannot take away from us. This is stuff that we do for each other every day, that we do for our friends every day, that they they cannot wake up one day and tell you, stop your voice training. Stop wearing your makeup. Stop wearing clothing that affirms your gender. This is stuff that we can always do for ourselves. And they cannot take it away from us. And I just find like a lot of it just makes me feel good to know that like we can still take care of each other even when some stuff is definitely going wrong in this country, but like we still have this for ourselves, for our friends, and yeah, just know that like there's always stuff that we can do for each other, even when it feels like the world is falling apart because of all this antitrust legislation that continues to pop up. We're gonna go back. I think I'm flying through this presentation. I might definitely end um before it's over. All right, so thank you everyone for participating in this little interactive Mentimeter. Now I'm going to talk a little bit about hormone replacement therapy. Um, but before I start, because you know, I know y'all are here on the conference with Plume, so you probably already know what hormone replacement therapy is. Maybe you have been a hormone replacement therapy, maybe your friends. Um, so I'm going to be touching on some like stuff that like we talk about when you come to the clinic for hormone replacement therapy, but I want you to put in the chat if there's any questions that like you're curious about, something that you're like, oh, I know about this and that, but actually I have a question about this or that, because I want to make sure that if I know the answer that I touch on it, because maybe I don't have it in the presentation. So if there's something that you want to ask a question about, please put it in the chat, so I don't um miss it. So let me see. Let me see the chat. Oh, I see you. I also put gender affirming care in the chat. Electrolysis, makeup, fashion. Yeah. The name of the cat is Suko, like the Avatar character. Right. Mhm. Okay. So hormone replacement therapy. So for those of you that maybe haven't heard what hormone replacement therapy is, what is it? It is a medical treatment of using hormones. This can be testosterone, it can be estradiol, it can be estrogen, it can be anti-hormone blockers, and yeah. Okay, so it does say administered to transgender or gender non-conforming individuals, but actually, this is also gender affirming care that cisgender folks get. Stuff that cisgender women get. This is stuff that cisgender men get. Um, and it's gender affirming care for them too. So gender affirming care is for everyone, not for just us gender not conforming folks. And I really wish cis people understood that. The world would be so easier if they understood that everyone gets gender affirming care. So what does HRT do? It can help you align your physical and emotional alignment with your gender identity, with your expression. And again, it's not one size fits all. All care is individualized. So, like, say, there's some people that can get on a high dose of testosterone because they really, really want to start getting a lot of beard. Maybe they really want to start getting muscly. They want their voice to be as deep as can be. Um, there's some people that can get on just anti-hormone blockers, but they can choose not to take estradiol, they can choose not to take estrogen. Or there's some other folks that like more like an androgynous changes. So that's why they would do like just a little bit and not the full amount. Like myself, my transition, I liked it to be androgynous. So testosterone, instead of taking like a full dose, I would take small amounts. So the changes are so very small. I personally don't want a beard, like a full beard. So that's why I take like small. But if what you want is a beard, you can definitely achieve like what you want if you tell your practitioner what it is that you're looking for in the changes. So, How does one take hormone replacement therapy? So, as you can see, there's only a few of testosterone different methods of administration, and there's a lot of estrogen, anti-androgen, and progesterone. So, yeah, for testosterone, you can take a transdermal gel. What that means is like it's like a little patch. You put it it's on your arms, on your shoulder. I think you can also put it in your thigh. Those are like the spaces in your body where it absorbs the most very well. There's also injections. IM means intramuscular. That means when you put the syringe all the way into your muscle at a 90-degree angle. Um, yeah, I see some faces. That's the one I used to do. And then there's subcutaneous. So that one, you inject it at an angle, I believe it's like 45-degree angle, and that one goes into your fat. So the difference between these two injections is the absorption. So if you do injection with intramuscular, it goes right into your muscle. So what's in the muscle? There's a lot of blood vessels. So it's going to absorb very fast. Let's say like you start feeling, for those folks that are on testosterone, you feel something like the next 2, 3 days after you take it. And then if you do subcutaneous, since it goes into the fat, there's way less blood vessels that are in there. So the absorption, instead of like it being 3 days, it'll be between like 5 to 7 days. So this is something to consider if if you're taking other medications. I will say I feel like maybe there's like not as much research on this yet. But between me and my community and other people that take hormones, um, for example, we have found some, ¿cómo se dice? Interactions with other medications. So let's say I know some folks that take ADHD medications, right? So some people that take Adderall, when they are not taking their testosterone, the Adderall is fine. When they're combining Adderall and testosterone, it will make them feel sad, something that they wouldn't experience with just like the ADHD medication. And this was when they were taking intramuscular injection. So the absorption was like very, very fast. And they found out that when they changed it to subcutaneous, they started being able to like their mood swings were way less. So it really, again, it really depends on what works best for you. And I encourage y'all to like, oh, this method is not working for me. Maybe I shouldn't be taking it. No, you can try other ways to see what works best for you. Now, there's also something called subdermal pellets. Have y'all heard of those? Because those were new to me until a few months ago. So, subdermal pellets, basically, they do like a little incision. I think it's either in your butt cheeks or in your lower back, but they do an incision, then they put a little pellet inside you, then they close the area, and the hormones continue to like release through the months. I believe it's like every 6 months so you have to get subdermal pellets. Now, for estrogen, we do have pills. We also have injections. We have patches. Of course, these injections can also be intramuscular and subcutaneous. And the patches are the same, like in the picture. You just put it on your arms. And then we have pills that you can take, like spironolactone. That doesn't roll off the tongue for me, but there's a lot of pills that you can take. So there's like different options for people to try. You're like, maybe I don't like how these pills makes me feel. Okay, here's another one. So just know that there's like different options for you to try. I don't want people. I know people like going like, no, this is really like not working for me, and you stop hormone replacement therapy all over. There's so many options that you can try. Um, I'm gonna open the chat to see if there's any questions so far. Lower doses. So if anyone is wondering why there's a lot of pill options for estrogen, but none for testosterone. Um, so what my practitioner had told me is that basically they haven't been able to synthesize a way for testosterone to still be like active on a pill because I would very much love to just take a pill instead of injecting myself every week. I don't love syringes, but that's what we have for now. Yeah, so that was just it on about what ways one can take your hormones. So on to the next section. So we're just gonna talk a little bit about what you can expect when you start taking testosterone, estrogen, estradiol, when you start your hormones, basically. So, um, some stuff that you may know, for say, estrogen, your skin can get very soft. You have like a decrease on oil. It might make you start getting less acne if you were getting some pimples or not. Um, your body hair, instead of it being thick, it starts being more fine. So you can as a doctor, they tell you like when we have our patients, we do tell you you may have a decrease in sex drive and a decrease in spontaneous erections. However, some of my friends that are on estrogen, they've told me that it's the opposite, that they actually have like an increase in sex drive. Now, we don't know whether this is because they're taking estrogen or it could be because you start feeling more like you. You start feeling more confident. You start feeling like, hey, this is what I want to look like. Um, so again, all the changes, just because they happen to your friend doesn't mean that they're going to happen to you. It looks different for everyone else. Um, Another thing is going to be redistribution of fat and mood changes. This is going to be the same for estrogen and testosterone. So if you start taking testosterone and you are very curvy, your curves may start to disappear, making you look like a little bit more square. If you start taking estrogen, maybe your fat starts moving more like to your booty. You start seeing like a little bit more of a waist, maybe. Um, so for testosterone, instead of our skin softening and the oil decreasing, there's actually like an increase of oil. So unfortunately, on testosterone, it might make you prone to more acne. Um, it's one of my least favorite things, but it's definitely a thing that I see happen with a lot of people starting testosterone. But this is something that you can fix if you not fix, but like control if you go to a dermatologist. Now, contrary to estrogen, instead of your body hair being more fine, you're gonna have thicker hair, maybe even darker. Um, your muscle mass, it will be easier for you to start getting muscle if you start like going to the gym. And there's definitely going to be an increase in sex drive and energy. Your energy changes a lot when you get on testosterone. Um, so for folks that are on testosterone, they go through the menstrual cycle. I know as you go through like the luteal phase and the ovulation, there's like some days or like a whole week in the month where we feel like a little like less energetic. Like if we go to the gym, you like lift like way less. You're able to, you just feel like tired. That kind of goes away on testosterone. You just feel like energized all the time, which is really fun. And another thing that can happen is vaginal dryness. So this is important for you to like if you start taking testosterone, if you're able to continue to go to the doctor at least once a year. One thing that can happen is called atrophy. So basically, your reproductive system it runs on estrogen. So when you start taking higher doses of testosterone, your reproductive system is fighting like hello, where's the estrogen that we need to like continue to function as normal? So what this can look like, it can be that you start experiencing a little bit of pain during sex. If you have penetrative sex, it can be that during penetrative sex you start bleeding a little bit. It can be that you start cramping a little bit during sex. Now, this doesn't have to be something that just it's going to happen when you get a testosterone. There's a lot of medicine that you can take to continue to give your reproductive system the estrogen that is lacking. So there's two ways that you can do it. So you can either take estrogen pills, like you can maybe take like some birth control as well, to continue to give your body back some estrogen so your reproductive system stabilizes a little bit. But if you don't want to do that, because it could make you like regain some of your curves, you can do localized estrogen. So they give you like let's say like suppositories that you insert vaginally so that the estrogen is just like in your reproductive system. So just know that there's a lot of options out there for you to achieve what you want to do without feeling like it's like beating at your body, right? Um, Now, few things on HRT. All people make the same hormones. Whatever gender, whatever you were assigned at birth, you make estrogen and you make testosterone. We all just make it at different levels, right? So that's just something that like um it's like good to know. It's like, oh, everyone has the same hormones. It's totally normal to want to have more of some hormone than the other one. All right. So I want to talk to you a little bit about some stuff that could stop you from being on hormone replacement therapy, also known as contraindications, right? So if you happen to be having like some liver issues, if you have cancer in your family, maybe you have artery problems, maybe oh, you definitely cannot take testosterone if you are pregnant. Now, these few things that I'm mentioning, they're not always absolute, but I do just want you to be aware that it's important if you're able to go to the doctor before thinking of starting HRT because I know that you can start HRT without having to go to the doctor, right? I know your friend can be like, hey, I just got my testosterone. I have like three big vials. I know you want testosterone. Do you want to start? Or your friend like, hey, I just got my 6 month supply of estrogen pills. Do you want to go ahead and start? I know at least myself, I started my HRT journey without going to a doctor. Right, I just did it. Now, I'm lucky that I work with Feminist Center where we offer gender affirming care and they're able to run my panel of blood to make sure that everything is fine, right? So I don't want you to look at this slide and get scared. This is not stuff that is definitely going to happen. I just want you to know that it's important stuff to look at and to think of if you know that in your family like there's history of high levels of cholesterol, there's history or you know that you're prone for diabetes, you know that you're prone for increased blood pressure, to think of that and check if you're able to go to the doctor. I know that it's not always a reality or a possibility for everyone to go to a doctor before starting your hormone replacement therapy, or like I know that maybe it's not possible to go like every year. We know that healthcare sucks in this country, so yeah, just just to be aware that it's good to go to a doctor and check. All right. So what does like going to the doctor to make sure that everything is fine look like? Oh, I see stuff in the chat. So let me see. Estrogen can give you boobies. It definitely can give you breast growth. Yes. Mhm. Oh, thank you, Daisy, for sharing your journey. Um, oh, I see. Oh, Daisy, I was just listening to you talking um in the yoga session. Yeah. I was like, this Daisy rings a bell. Yes, I was just in the yoga session and listening to the last of your chat. Um, Thank you for sharing your journey. So, yeah, when you go to the primary care, it's important to check if you can get a screening for cervical cancer. Pap smears are important to get like at least every 3 years, especially if you're having penetrative sex. Um, Getting breast exams, getting testicular exams, checking your blood for cardiovascular risks. Um, Now, another thing that is important is your mental health, right? Like I mentioned, with hormone replacement therapy for both estrogen and testosterone, there's going to be mood changes, right? I know for me, I had a lot of mood changes when I first started my hormones, and I started seeing like depression and anxiety popping in, interacting with other medications. Um, so it's important that you have a support system. So again, healthcare sucks. You're not always able to get a therapist. You're not always able to get a psychiatrist, but it's important to have friends you can talk to, um, like chosen family, someone that maybe is also going through the journey so that y'all can go through it together, so that you don't feel alone, so that you don't feel that all these changes are only happening to you. It's just important to have a support system. And yeah. So another thing that I want to touch on for hormone replacement therapy is that let's say you're young and you're thinking about what's it going to look like because you want to be parents maybe, because us transgender non-conforming folks, we also have the same reproductive desires as just cisgender people do. You may also want to have a child, right? So I want you to know that your fertility can change when you get on hormone replacement therapy. So if you are thinking, hey, I want to be a parent, or your friend that you know of wants to be a parent and they don't know that the fertility can change, it's important that you talk to your provider so that you can talk about the options that you have. So this can look like sperm freezing or egg freezing, right? Um, because the impact the external hormones can have on your fertility, they can be reversible or they can be permanent. So this is just like something to consider if you're someone that you think that you may want to have kids. So again, there's no absolutes. There's stuff that can be reversed. There's stuff can be permanent. So it's not, I'm not telling you if you get on testosterone, you will be infertile. I'm not telling you if you start estrogen, you will be infertile. This is all different for everyone. So it's important to talk to your provider if you can. So I also want y'all to know hormone replacement therapy, it's not birth control. It's never birth control. Never. Um, I have had to tell some of my friends that are like my same age. I'm 26. So I'm like, you you think you might be pregnant? And they're like, yes, but I may not because I'm taking testosterone. Testosterone does not stop you from getting pregnant. And a pregnancy on testosterone, if you want to keep it, it's very dangerous. If you find out that you're pregnant, you have to stop testosterone at once, right? Um, so yeah, this is just something that I really wanted to touch on because I have a lot of times that working for feminists, I go and table at like other events, and we offer lube, we offer dental dams, we offer condoms, and a lot of people decline, telling us we don't need condoms. We're on hormone replacement therapy, but that's never going to stop you from getting pregnant. If you have penetrative sex, that it's penis inside a vagina, there's a chance that you can get pregnant. Okay. You also need a condom. People are like, well, I'm a lesbian. I use a strap. I don't need a condom. Yes, you do. If you're using the same toy with other people, there's a chance for STIs. So it's always good to have condoms in your back pocket, right? Well, maybe not in your back pocket. They can get pierced, but you know what I'm saying. Um, so let's see. Okay, I'm definitely early, but we still have time. So I want to open it up for you all. I want to see if you have any questions and just questions from everything that we talked about today. Do you have any questions about this legislative process? Do you have any questions about how you go approaching an organization? Do you have any questions about gender affirming care? And it's just been me talking for the past hour. So if you want to ask your question coming off of mute, you can also do that. See, I see someone raise your hand. You can go ahead and just come off of mute
Oh,
if you wish
well,
to.
you mentioned the blood clots part, and I can speak to that firsthand because I was on estradiol. I started with patches and then went to pills. And then I went to my endocrinologist and I asked him if I can go on progesterone. He didn't even know about that. So that was kind of a scary thing that my endocrinologist didn't know about having progesterone. But having said that, I was on the two of them for about 6 months, 8 months, and I started to feel tired and out of breath. And I just put that up to being out of shape and being old. And it started to get progressively worse, progressively worse. And it got to the point where I would walk 50 or 75 feet and then I have to sit down, walk 50 or 75 feet, and then I have to sit down. And I went to the emergency room and they did whatever tests they needed. And my D dimers are supposed to be like 100 or 200, I believe. And my D dimer was 1,000. So they immediately said, "You need to get to the emergency room right now. Do not wait. We'll even get an ambulance here." And I said, "Well, the emergency room is like 3 blocks away from the urgent care." So I said, "I'll just drive myself there." And then it was kind of funny. I'm sitting there in a, needing urgent care, and you're sitting there waiting to get checked in a half hour. And then they took all the numbers, and I was in intensive care for like a day. And then the rest of it, I was on heparin drip. And then they did a, an ultrasound on me, and they said that there was stuff in my lungs. And then they did surgery, and there was no context of size, but there was a large clot that luckily, if you can call it luckily, ended up in my lungs. So it was a pulmonary embolism, because if it would have been in my heart, it would have been a heart attack. And if it would have been in my brain, it would have been a stroke. So, that shit's for real. So I have to completely go off the estrogen part. I'm still on finasteride. I'm still on duosterid. Um, so I'm on the anti stuff, but I'm not on the E. So, as you mentioned in one of your slides, that shit's real.
Yeah, and thank you for sharing. That's like speaks to the importance of having community. So I know maybe not everyone's like, oh, I don't like to get out there and like meeting people and like, I'm shy. Um, like Plume, they offer online communities. So it's important to talk to other folks that are also going through these journeys because like I said, I feel like there's like a lack of research on what hormone replacement therapy does to your body. Um, like what sorry, is it Ilana?
Ilana, yes.
Like Ilana is saying, this what happened to you could have been avoided. It could have been avoided, and it's crazy that the endocrinologist.
Well, I don't know that it could have been avoided because I started on patches, dealt with them fine. Then I went off patches to pills, went with them fine. It might have been the synergy of estradiol and progesterone, so maybe they synergized and became stronger and overwhelming. So
Mhm.
maybe if I would have stayed on estrogen only,
So what I
that
mean by we could have been avoided is like if the doctor like maybe looked at like your blood labs like, hey, it looks like you could be prone for this and that, so let's take us like a lower dose and come back after a few weeks and let's check how you're doing and this and that. Like doctors checking in on like what's happening. Um, but like I'm
Oh,
also really
absolutely.
sorry that
I
I'm really
mean,
sorry
the
that happened.
reality is that had I not gone with this particular, I went with one endocrinologist that I felt had no knowledge about what was going on. So that was strike one. And then his office staff was terrible, really terrible. Um, they were really snippy with me. So I left them for another endocrinologist who seemed fine. But had I gone to like a Planned Parenthood, like a Plume, like a whomever, a Folks or whomever, and gone through some organization that was highly knowledgeable about this particular sector, I think this entire adventure could have been completely avoided because they would have recommended the types of treatments that you were saying, starting with lower dosages and knowing that maybe let's hold off on progesterone for the moment. Let's stick to estradiol only. And like you said, I hate needles, so I was happy with patches and pills. And there's also the reality too, with patches and especially the release is very much steady and even. With injections, you get the highs and lows. You get uh, the spike that comes right at the injection and then it tails off. So that is also going to be a factor.
Yeah, and I find like you're not the first person that I hear that was with an endocrinologist and that they were having adverse reactions to how the treatment was being given. Um, so like I mentioned at Feminist, we do also offer hormone replacement therapy there. So I definitely have gotten folks before that were experiencing like a lot of reactions from their hormones. We got this trans mass guy and they were telling us like, hey, like I go in for my shot with my doctor, but then for like a week, I feel so tired. I get so moody, really angry, and my body hurts and my head hurts. So turns out that where he was going, they would give him like an entire little vial, like, or I think it was like, I think he said 1 full milliliter. Um, and they would just give it to him like at once. And that was, yeah, that was very, I was not expecting him to say that. But we're like, well, with that being said, unfortunately, this is why you're getting all the symptoms. This is why you're getting a headache. This is why you don't feel like you can move like for a week. So the way that we do it at our clinic, when you first start hormones, they start you at the lowest dose, which is I believe is 0.125. Um, And after 6 weeks of taking 0.125, you go in, we check your blood. If everything seems fine, we can up your dosage maybe to 0.3, maybe to 0.4, what it is that you want to be taken, right? But it is important like to monitor. And if you feel like you're not getting the care as you should where you are, if you have the chance, please go to someone else because there's so many cases that I've heard of like doctors, like you go and you tell them, hey, I'm feeling this, and then they're like, well, I don't know what it could be, but I'm sorry. Sorry we couldn't help you. Um, so that is then when you go with your friends, like, hey, has this happened to you? Because this, and this is happening to me, and my doctor doesn't know why. Um, that speaks to the importance of community. Um, does anyone else have any questions, anything else that you would want to share? Um, sorry, I see someone in the chat, Jenny. Does your cardiologist, is he aware also of the hormone treatment that you're undergoing? See, I wish all the doctors had to be LGBTQ trained and they had to know trans people exist and people take hormones. Um, but yeah, I would say like if it feels safe to you to tell him, maybe you don't need to tell him why you're taking it. But if you tell him that you're taking some hormones and you need to, maybe you don't even need to tell him that you're taking the hormones, but you want to tell him that you're, ¿cómo se dice? At risk for clotting and you want to be checking your blood, I believe he should just check it. He doesn't really need to be asking you a lot of questions that you don't need to be answering. So if you feel safe to talk to your doctor and tell him that you are taking hormones. Oh, if you're
I read somewhere there's a product called horse serum replacement, some. So there's like a conjugated replacement other than estradiol. I don't know exactly what that is. So I'm not exactly sure if there's any other replacements to estradiol.
just live with the risk. Yes. So if they're out and they know that you are transitioning in your hormones, I encourage you to speak to him to the fact that you like are at risk for symptoms and clotting, and that you know this. This can be true for people taking our hormones, and you would like for him to like monitor this for you. Um, and
Yeah,
if they do refuse, you can ask them to put on your chart, hey, I want you to write down that you refuse to do this, this, and that.
well, it's a huge risk, and I am on anticoagulants. I am on Eliquis, so you know,
Oh, sorry, Lana. I was speaking to the Jenny. They're putting
oh,
in the chat about their doctor.
oh, I'm sorry.
So, oh, I think my laptop is dying. What's happening? Okay, so thank y'all for sharing your experiences, for sharing your questions. Oh, why does this not let me go back? Okay, let's just do this. All right. So, thank you all for joining the session, for staying, for asking questions, for participating. Um, if you want to continue to hear from feminists, please follow us on Instagram. You can join also our newsletter. On the newsletter, we'll be posting during legislative session for the bills, for what is changing, for what's happening at the Capitol. I leave y'all our handle right there. And to sign up for our newsletter, you just go to feministcenter.org. You can sign up and you can hear when we're hosting workshops. We do a lot of online workshops. Um, so you're able to join us. Please, if you learn anything that you didn't know today, go out and share with your friends. And yeah, just thank you so much for everyone for joining today. I hope you continue to enjoy the rest of the conference at Plume. And I hope this is not the last time I see y'all. My computer's not working. How do I end this session?
Uh, it's gonna be a button that says leave or something like that.
Here we go. Okay, awesome. Okay, leaving now. Bye, everyone.
Bye.
Bye.